name is McGuire. I'm the president and CEO of Second Sight. We're based in Los Angeles, California. My background has been primarily medical devices. I would say before Second Sight, the majority or almost majority were in the cardiovascular space, whether it be coronary stents, pacemakers, defibrillators, things such as that. And I have a master's degree in business and an undergrad in civil engineering. Has nothing to do with medical devices. So as I said, we're based in Los Angeles. We are focused on prosthetics, visual prosthetics, to give artificial vision to individuals who are blind. Right now we have one product that is approved by the FDA. We also have a CE mark as well as approvals in other countries, and it's called the Argus 2. And so again, it's a retinal prosthesis, and I can briefly describe how it works. The users have glasses. They wear glasses. The only purpose of the glasses is to mount a camera here. The camera picks up video, footage in front of the user. That video is then transferred to a computer that they wear on their side, a video processing unit. The video is converted to instructions. It's sent back to the glasses, and then a signal is transmitted wirelessly to an implant that's on the eye. And so basically an electronics package that a retinal surgeon straps to the side of the eye. The surgeon then, from that package, they'll have a small hole in the eye, and they'll put an array with 60 electrodes, so think of it as 60 points of stimulation that's tacked to the back of the retina. So what happens then is the system captures video, transfers the video to the VPU, converts it to instructions. The instructions go back to the eyewear. We have a transmitter there that then sends this signal to that electronics package. And then the electronics package then sends electrical pulses to the array that's on the back of the retina, and that array creates images and scenes that match what the video camera sees. So our patients now have either bare light or no light perception. Again, retinitis pigmentosa, so they're advanced stage, late stage retinitis pigmentosa. And our best patient could not see this, so they cannot see hand motion. Best patient could walk outside and maybe tell you if the sun was out or sun was not out. And then so what we do is we give them a form, again, of artificial vision. It's not like our vision, but it does allow them to start seeing shapes. They could see doorways, windows, tell where people are in a room, maybe see their cat come across the floor, maybe see fireworks for the first time in 10 years, things like that. So again, not like our vision, but it starts restoring more, I guess, mobility and orientation, and then a greater sense of connection to the surroundings. So at this point, we've treated about 300 patients worldwide. We have, as I said, we are FDA approved. We have reimbursement in the United States. We have coverage in the United States for about 70% of the population. We're also reimbursed in Germany, France, parts of Italy, and we're in a program to get reimbursement in the UK right now as well. Great question. The best thing would be to call Second Sight. So if you go to our website, there will be a place for patients or potential patients. There's a 1-800 number. You can call that number, and we have someone at Second Sight then that would ask you a series of questions to see if you may qualify for our technology. After that, if it looks after maybe 2 or 3 or 4 questions that you qualify, your name would go onto a list, and then there would be a second person that would give you a call at some point that is a medical professional that could have a much more in-depth conversation and derive whether or not you're a candidate. If you are a candidate and you want to move forward, the next step is we would then introduce you to one of our implanting centers, and someone from that center would contact you. The physician that does the surgery is a visual retinal surgeon. but most likely you would be contacted by a clinical coordinator. At this point, if you live in the U.S., we have approximately 20 locations in the U.S. that are implementing the Argus 2, and we're opening up additional locations later this year. It's going to be to have the disease retinitis pigmentosa, and it's going to be an advanced stage of the disease so that your vision is no better than bare light or no light perception. All of the patients need to have had vision before, and that's kind of the basic qualifications. Past that, they'll look at other medical complications, maybe assess do you have support at home and people that can help you with the rehab and the training. But really it's do you have retinitis pigmentosa, and is your vision to the point of bare light or no light perception or worse? And from there we'll do additional evaluations. Sure. We just started a U.S. feasibility study with a product or technology that we call Orion. And Orion is to treat almost all forms of unpreventable blindness. So in the initial trial, we'd be treating patients with glaucoma, diabetic retinopathy, trauma, and maybe other optic nerve diseases. And the way this technology works is it's similar to the Argus 2 in that a patient would wear glasses with a camera. The camera would capture video in front of the patient. That video would then be converted to instructions, but instead of stimulating the eye or the retina, this product, we basically bypass the retina and we bypass the optic nerve, and then we transmit a signal to an electronics package that would be in the skull right here, and then we have an array that a neurosurgeon actually places on the surface of the visual cortex, and we stimulate the visual cortex. And we do the same thing, or we attempt to do the same thing that we do with Argus 2, which is create these patterns of light. So start creating shapes of objects and allowing them to see not only objects, but motion, contrast, doorways, windows, things like that. Again, that's very early. We're going to do 5 patients in a feasibility study. We have announced that we've enrolled 2 patients, so 3 more patients to complete the study. And then we'd have a conversation with the FDA about what a next trial for approval would look like. That's a good question. Not initially, but I should probably point out that we have our technology, the Argus 2. We did do a 5-patient feasibility study with the Argus 2 in macular degeneration patients in the UK. We did it at Manchester with Professor Stenga, and we're in the process of following up those patients right now. We have not shown objective benefit to date with our technology, these patients using our technology, because the residual peripheral vision is still relatively good compared to the quality of vision that we provide. But we were able to show that we could provide some artificial central vision for patients with dry AMD, and we were able to show that the patients could integrate the artificial central vision with the native or residual peripheral vision. So parts of it were promising. We didn't quite have the level of vision we think that's required to show objective benefit. We're going to continue following up those patients. And at some point, we'll probably make a decision to do further research with AMD patients, dry AMD patients. Again, with the intent of providing intent of providing central vision from our implant. Again, probably the best way is to contact us directly, contact Second Sight. We have good relationships with our Orion study, for example. If anyone thinks that they may be a candidate for Orion right now, as I said, we're doing a feasibility study at UCLA and also at Baylor Medical Center in Houston, Texas. But past that, we maintain a pretty extensive database of potential patients in the United States. So we do a lot of radio advertising, both on national radio, but as well as in different geographic markets. And even for patients that we cannot treat now, either with Argus or we do not have a clinical trial currently for those patients, we still like to enter them into our database, and we will send updates from the company from time to time. And if at some point we think we have a technology or a clinical trial that may be applicable to their condition, then we will make a phone call or an email and approach them and let them know what we're doing and see if there's some interest. So we've got probably over 1,000 patients in our database now, and it's something that we're really investing in and tracking and then trying to stay close to all of these potential patients.